People with COVID complications have the option of seeking monoclonal antibody treatments through the REGEN-COV-19 shots. But now, due to demand, there's a statewide shortage. Health providers are rationing doses across the state, and tonight, Kalisha Moore is asking local hospitals how they're catching up. She joins us live in Warner Robins with what hospital leaders are saying.
Lori, if you can remember, I was here just earlier this month talking about Regeneron, an option for COVID-19 treatment. Now, this very clinic, just like many others around the state, are saying they're seeing the effects of the shortage. Linda Gove is one of the thousands who got the Regen COVID-19 treatment at Houston Health Pavilion.
Prior to getting sick, I had been kind of doing a little bit of research as far as what I would do if I got sick.
The treatment combines 2 monoclonal antibodies to fight the virus and keep serious symptoms and hospitalizations at bay.
I believe it was effective for me. I don't doubt for a minute that it's what kept me out of the hospital. And if I get sick again, I will go try to find it again.
As a result of shortages due to demand, the government announced it's changing the way the treatments would be distributed. That shortage has hit Houston Pavilion. In a Facebook post, they said their ability to provide to its patients has been affected. But at Atrium Health Navicent, Dr. Sandy Duke says that's not the case.
And the allocation from the state is based upon your use. So we've not experienced a decline in the amount of monoclonal antibody that we've received, such that it's not required us to change our prescribing patterns, and we've not seen a challenge to us meeting the needs of the community in our facility.
He says since the beginning of the 4th COVID surge, they've administered 100 treatments, while Houston Health Pavilion has surpassed 2,000.
The way that we do it is that your physician or emergency room or urgent care could make a referral based on the diagnosis of COVID and the risk of you having complications from that. And then that referral would become the order for you to receive monoclonal antibodies.
Gove says the treatments have worked for her, and she hopes everyone can get it.
Of course, you have to test positive, but then you have to be over 65, or you have to have underlying conditions and things like that. To me, anybody that needs it, it should be accessible to them.
Now, Dr. Duke says they find themselves in a pretty good position as far as inventory, but as far as Houston Health Pavilion goes, they says they are working with suppliers for more inventory, and they maintain that the public should get the vaccination as the best defense against COVID-19. Live in Warner Robins, Kalisha Moore, 13 WMAZ News.
Thanks, Kalisha. The Georgia Department of Public Health says they will identify which sites in the state will receive product and how much. They say monoclonal antibody treatments are not a replacement for the vaccine.